Hi, my name is Athena,
Hi, this is Lola.
and our project is going to be on how Alzheimer's affects the patient's senses. Our first slide is going to be on sight, and so Alzheimer's causes neurological damage that affects the patient's perception as well as memory and cognition. This, however, does not mean that the patient's vision will become completely dark. However, this does mean that the perception is lost. So, for example, when you think of a patient with Alzheimer's, you think that because they say that they lose sight, that they're completely blind or they have very poor sight. This is not the case. Someone that has Alzheimer's can have actually perfect 100% vision, but they just cannot recognize an object. Often symptoms are loss of visual acuity, loss of color vision, and visual fields, and the brain's ability to interpret the image that they're seeing may be decreased. So this causes confusion, disorientation, and then the inability to recognize familiar faces and places as well as objects. And not only does Alzheimer's cause disorientation, but it also causes hallucination and distortion in the vision. A message, so this is how it kind of happens in the brain. So a message from the eyes, for instance, follows the optic nerve to the thalamus, which then forwards it onto the visual cortex in the occipital lobes, and this is all affected when someone has Alzheimer's. So this is not the signaling may be the same, but the brain does just not process it. And so scientists and doctors have found new research that shows how Alzheimer's can be diagnosed early. And if on the picture on the left, we can see that this is an eye, and due to the kind of cloudiness of the eye, then doctors can figure out if this patient has Alzheimer's before actually predicting it. So by studying a patient that has Alzheimer's, the difference between a healthy eye and an Alzheimer's eye are drastically different. And this new discovery will allow doctors to find the disease early on and start treatment as soon as possible in order to prevent it. And so there are a few tips on how to manage this decline. So the first one is to create color contrast between floors and walls to make visual depth. So patients with Alzheimer's can kind of see that because this is a different color, then they either have to step up or step down or kind of avoid that area. And to, as example, in one of the pictures, mark the edges of steps and stairs with brightly colored stripes of tape to identify height edges and changes, and also place brightly colored signs or simple pictures on doors for easier identification.
Alright, so we're going to move on to smell. So smell is one of the first symptoms noticed with progression to Alzheimer's. So scientists started studying a protein called beta amyloid, which is a naturally occurring protein in the brain. So there are pictures that show the concentration of amyloid in the brain. So the first one right here is an Alzheimer patient, and the second one is a normal aging person with no amyloid. And then the third picture is a normal aging person again, but with amyloid. So the question being asked by scientists is why the Alzheimer brain and the normal aging brain with both amyloid, they both have the same concentration, but why does only the Alzheimer patient have Alzheimer's? So they began to think, and they thought it was the concentration of tau, which is also a naturally occurring protein in the brain. So to test this, they gathered a group of people, asked them about different senses, asked them to smell each one, and they had to repeat back what they smelled. So then they would put them into a PET scan to see the amyloid and tau concentration in the brain. So in these pictures, so the green right here is where the tau gets deposited as we get older, and also this is the part of the brain that is involved in memory function. So then here's the red, and that region is where tau gets deposited when amyloid accumulates in the brain. And this is when scientists begin to see people develop cognitive difficulties that are more than just memory. And the blue, so these blue areas in the brain are where tau gets distributed when individuals have the Alzheimer's disease. So we see here, so here's young adult, older adult, and Alzheimer's. The young adult has absolutely no tau in the brain, and as that person gets older, there's a little more warmer spots in the brain, so that's showing more tau, and an Alzheimer's patient has absolutely tons of tau in their brain. So by doing this experiment, scientists can see patients at their stage of where they are in their progression to Alzheimer's. And this is very crucial so people or scientists can prescribe the medication they need.
Okay, so for hearing, the loss of hearing in a quote-unquote normal patient is a highly vital kind of sign, because the loss of hearing could lead to Alzheimer's by making them A, socially isolated, and B, their strain of decoding sounds over time may overwhelm the brains of people with hearing loss, leaving them more vulnerable to Alzheimer's. So there was a case that was studied researched in the 1990s, and the case kind of went on for 12 years. And so the research that was performed was they had a very large group of people from different ages, from either 60 to 90 or 50, so just a really vast number of people in different ages and in different stages. And so the group was first tested, and then after about 12 years, they came back and the researchers tested them again. And the group of people that had a mild 25 decibel hearing loss and up, so as you can see, this is the slight loss, and then up, kind of going down to severe. Those people all turned out to have Alzheimer's and some form of dementia, while the ones who had perfect hearing did not have any cognitive mental disease that kind of was produced in their later stages of life. So for the participants age 60 and older, over 40% of them were at a high risk of Alzheimer's if they had poor to semi-poor hearing. So basically, the more severe hearing loss a patient has, the more risk they have of having the disease. So as we can see here, for every 10 decibels of hearing loss, the risk of the disease increases by 20%. So this all means that Alzheimer's is directly related and is affected by one's hearing. To kind of sum up the hearing, an Alzheimer's patient can have perfect hearing, but this is just a rare case if they do have perfect hearing. But they will not actually be able to process the sounds, and so they cannot distinguish between a barking noise or a person talking.
So there are different symptoms of Alzheimer's that can be seen through taste. There can be a loss of appetite because of poor communication skills based on their condition, depression, pain, fatigue, or even due to their medication. There's also symptoms of reduced recognition, and this is because of this, dehydration is a major concern, because if they can't recognize thirst, that's very bad. And also there's a change of motor skills, so they won't be able to chew and swallow. And the researchers studied 3 groups of patients: those with frontal variant frontotemporal dementia, which is FVFTD, and those with semantic dementia, and those with Alzheimer's. And it was found that the frequency of appetite changes in food preference, oral behaviors, and eating habits was higher among the FVFTD patients in comparison to Alzheimer's disease. And also, when they focused on somatic dementia patients, changes in food preferences and eating habits were also greater in comparison to Alzheimer's patients. And it was concluded that these changes likely reflect changes in the ventral frontal lobe, temporal lobe, and amyglobia, so frontal lobe, temporal, and the amygdala. So moving on to touch.
Okay, and to kind of now conclude, the last sense is touch. And so as with all of the other senses, sensitivity in touch decreases. So depending on how severe the loss is, a person with Alzheimer's disease may not be able to recognize being cold or hot or even being in pain. And so Alzheimer's affects the fine motor skills, like interfering with one's ability to unbutton / button clothes or use utensils like forks and knives. And dressing is difficult for patients with Alzheimer's, who sometimes feel overwhelmed by the choices and may not remember how to dress or how to tie a shoelace, buckle a belt. And so basically, from the mid to late stages of AD, their motor skills decline increasingly.
Thank you.
Thank you. Our presentation's over.